The Santa Cruz County Human Services Department strengthens our community by protecting the vulnerable, promoting self-sufficiency, alleviating poverty, and improving quality of life. In fiscal year 2015-16, we served almost 1 in 3 county residents by providing access to health care, nutritional support, emergency response to child, elder, and dependent adult abuse, foster care placement, child adoption services, in-home supportive services, veterans benefits, basic needs assistance, and job preparation for youth and adults. In 2014, as part of the Federal Affordable Care Act, MEDI-CAL expanded to include all California residents who were at or below 138% of federal poverty. Since that time, the county has seen a significant increase in residents' access to health coverage. In fiscal year 2015-16, over 73,000 individuals per month received MEDI-CAL benefits, almost double the number of residents who received these benefits prior to health care reform.
With MEDI-CAL, I would pretty much be out in the cold when it comes to medical because I have no income and no insurance. But it's been fantastic so far.
With the Affordable Care Act came an increase in the number of persons able to benefit from in-home supportive services. Over the last year, each month, the In-Home Supportive Services Program provided 2,500 persons with assistance, such as basic housekeeping, meal preparation, and personal care. Almost 10% more people served than prior to health care reform.
The services that I receive are to make things more independent for me. I'm a C5-6 quadriplegic, so there's almost everything from grooming to brushing teeth, dressing, and then meal preparation. My providers are now my friends because, it's a very intimate position that they have to deal with, and they're very kind, caring souls. So I'm very grateful that they're in my life, and we need to have more of them.
The CALFRESH program serves as the first line of defense against food insecurity for California residents. Over the last year, the department's diligence in bringing this benefit to all eligible residents has resulted in thousands more people receiving nutritional assistance. On a monthly basis, 14,000 county households received CALFRESH benefits, 20% more households than just 3 years ago.
I've used CALFRESH before. I was a single parent at one point. Didn't have much to provide for my kids and needed that cushion, and CALFRESH was that cushion for me to give my kids that extra food that they needed.
In 2015, the county received $1.1 million to continue the CalWORKS Housing Support Program, a housing assistance program for families who are homeless and receiving CalWORKS benefits. With this funding, the county has been providing housing subsidies, case management services, and other assistance to approximately 80 homeless families, with the goal of permanently ending their homelessness and fostering their long-term self-sufficiency through employment. Through its foster care program, the department provides safe housing for children who have been abused or neglected while their parents receive counseling and other services. In 2015, the department increased both the number of foster children placed with relatives and the number of licensed foster care homes. Also, because of the department's work over the past year, 40 newly adopted children have families that they can officially call their own.
I became a foster parent to help children. I had someone help me with my adopted children, and I just wanted to return the favor. Kids are fun, kids keep you young, and I'm glad to have the opportunity to do it. The Santa Cruz County staff has been great. They have gone over and above, more than I was expecting, in really providing support, training, anything we need, they are there for us.
The Adult Protective Services Program protects residents by intervening on the behalf of elderly and dependent adults who are unable to protect themselves from abuse, neglect, or exploitation, or who cannot secure the basic necessities of life due to incapacity. Over the last year, largely due to new outreach efforts, the program increased the number of referrals it received for program assistance by 24%. The department also continued to work closely with law enforcement and the district attorney's office as members of the financial abuse specialist team to address financial abuse cases.
It became evident in Santa Cruz County, as elsewhere, that there was a huge problem with our elderly population being taken advantage of by nefarious criminals that want to take their money. So in response, we created the FAST team, which coordinates law enforcement, social services, as well as our office's efforts to combat these types of crimes. We've gotten 100% participation from all the involved agencies. We've made a huge dent in stemming the tide of elder financial abuse. I think to date we've probably saved and or recovered over $60 million on behalf of our victims.
The County Veterans Services Office serves our veterans by assisting individuals and their eligible dependents and survivors to receive the benefits for which they are eligible. In 2015, the office generated over $3 million in retroactive and one-time benefits and almost $2.5 million in new annual benefits, a significant increase over previous years.
They helped me, guide me through what I was doing. And it really helped the 16 weeks of anger management that I took. The Veterans Center here has just been such a great help, and I can't say enough about it.
The county's Workforce Investment Board creates pathways to employment by connecting local job seekers with employers who are seeking qualified job applicants. Last year, the Workforce Investment Board provided 30,000 services to over 5,000 individuals. Through its early alert system, the Workforce Investment Board also provided approximately 35 businesses at risk of closing with the resources, training, and guidance needed to remain open, resulting in 50 at-risk jobs saved. While the Human Services Department is very proud of its accomplishments over the last year, there is still much work to be done. Some of the department's priorities over the next year are increasing the number of people who receive CALFRESH, providing health care coverage to children who are undocumented and newly eligible for MEDI-CAL, eliminating group homes for children in foster care, shifting the focus of the Workforce Investment Board's youth services to disadvantaged youth who are no longer in school, increasing access to in-home supportive services by recruiting additional qualified service providers, and finally, continuing to house the county's most vulnerable families. We look forward to meeting the challenges of the coming year as we continue to serve our community and improve the quality of life for Santa Cruz County's most vulnerable residents.